have access to it afterwards. And I just wanted to make sure that you knew it will be sent to you through email as soon as it is available. It should be pretty quickly afterwards, and then we will also do some editing and add it later again for anyone who didn't get a chance to view it. I apologize, we do not have any PACE credits available for this webinar as we are all commercial consultants. Please note the chat box. Keep an eye on your chat box, as we will be putting resources in there for you as through the duration of the presentation. All right, as we all know, we have to follow our participation rules and engagement. Please connect in the chat. Please talk to one another, share thoughts, and introduce yourself. Please take the time to be social. In this day and age, we all get locked away in our labs and we don't get a chance to socialize with this many people. Please stay on topic. Ensure that your messages and questions are relevant to the current discussion. This helps us maintain focus and a productive conversation. Please be clear and concise with your messages and brief so that you don't overwhelm the chat. Please don't overwhelm the chat with information that isn't pertinent to this topic. Please be respectful in your interactions. We want to provide an inclusive environment that considers everyone. Also, sorry about that. I just realized my phone was going off. I want to make sure it was silenced. And then please present with constructive contributions. Please share your insights, ask questions, but make sure that they are pertinent to the topics. If you have questions for your presenter, please use your QA chat box. If you are on a laptop or a desktop, you should be able to see your QA chat box at the top. If you are on a mobile device or a tablet, you will have to select the 3 dots and the chat, the QA box will pop up. Make sure that you put all of your questions in that box so that we will see them. If you put them in the chat, we may not see them because that's more for socializing, where if you want to ask questions to a presenter, they will go in the chat box and we'll review them and answer them as they come up. If you have any technical issues, please reach out to, yes, I do see that question real quick, sorry. Yes, this is being recorded, so yes, you will get a copy of it just for signing up. So if, for those who weren't able to attend or can't stay for the whole thing, you can go back and review it later. If you have any technical issues, you can reach out to info@labconnections.net. Oh, yes. Okay, so the chat box should be at the top if you're on a desktop, or if you are on a laptop, it should be at the top of your screen. There should be a Q&A button. If you are on a mobile device, then like a phone, or if you're on a tablet, you'll have to look at the more. There's 3 dots and a more. Yes, and then it should be available there. Okay. For today's schedule, we're going to cover histocompatibility testing updates, new personnel regulations, new rules for lab director responsibilities, and then we will pause for Q&A. Then we will change over to changes to the certificate of waiver, changes to provider perform microscopy, and Code of Federal Regulation amendments. And then that will also be followed by a Q&A. Then finally, we will get into the fee schedule and the incorporation of limited specific laboratory fees, followed by a Q&A and closing remarks. Your presenters today are Elena, Maria, and myself. We have Jay here as our moderator, and Aaron is in the background for technical support. I'm going to hand it over to Jay and Maria now. So thank you guys and welcome.
Okay, our first presenter is Elena. She has well over a decade of clinical laboratory experience and leadership experience. She specializes in compliance, quality, and leadership coaching. She founded Medical Laboratory Experts to empower lab leaders and address staffing shortages with training and offer a network of certified experts. So, Elena, how about it?
Thanks, Jay. Good morning, everybody. Thanks for attending. Super excited to go over some of these updates with you all. So as Jay mentioned, my name is Elena Pastawa. So we're going to go ahead and get going. You will notice that on each of my slides, I have a page number, and so that will correspond to the file that April shared with you earlier. So if you want to look at the actual regulation, that will take you right there, and you can read through all that wonderful text that they've saved up for us. So I'm going to start with HLA typing, disease-associated studies, and antibody screening and identification. So the biggest piece of this is that labs are now going to be required to install a continuous monitoring and alert system. So this is new for HLA labs. Prior, the verbiage was there, but it didn't require continuous monitoring. And so this is the change that now it's quote unquote required. And the goal of that is to monitor the temps continuously. I'm sure most of you are familiar and maybe doing this in your main labs. So yeah, just to ensure accuracy and reliable testing. So definitely a possible expense for labs that don't have a system like this and are still kind of working off the paper logs. Secondly, the labs are, of course, expected to establish and follow written policies and procedures for the storage and retention of patient specimens. The difference here is that they need to be based on the specific type of specimen. So, and this again directly relates to HLA laboratories. This is in the HLA section. So if you have a policy that's not based on specific type of specimen, that now needs to be parsed out. There's also a few examples that were removed with regards to antibodies. So they did take out verbiage that revolves around antibodies, antibody-coated particles, or complement. And that's because there's current and they're anticipating future technologies that are going to be allowed for the isolation and identification of lymphocytes or lymphocyte subsets. So they want to leave it open for other technologies so that it doesn't appear to be limited and so that labs can move forward with their technology. So I'm going to go ahead and go to my next slide here. We're still in the HLA arena. So these are just some small specifics. They did add the verbiage allele. So if you look through, instead of retyping, they're going to change it to allele typing, just to represent the typing done at the allele level, which is now becoming more common. And then they also removed the term at the serologic level for cross-matching. So this is going to account for your allele-specific antibody detection. Serologic typing is insufficient for current clinical histocompatibility testing due to its many limitations. So that's a term that they decided to take out. On to cross-matching and transplantation. So the lab must establish and follow written policies and procedures that address the transplant type. So they're looking for your written policies and procedures to address whether it's organ, tissue, cell transplant, as well as your donor type. So living, deceased, or paired, and the recipient type. So is the recipient high risk versus non-sensitized? You also need to be able to define when there's a need for additional recipient specimens for immunologic assessment, as well as the conditions in which you would need an additional specimen. So not only do you need to define when there's a need, but the circumstances that may go around that need. Definitely a good thing to discuss with your your whole team within, if you're in a hospital, discussing with your transplant departments. The lab must have written policies and procedures, I'm moving on to the second bullet point here, to obtain a recipient specimen for a cross-match or to document its efforts to obtain a recipient specimen, which needs to be collected on the day of the transplant. So basically, CLIA, in this case, they do recognize that the lab might not be able to obtain a recipient specimen on the day of the transplant, because it really does depend upon the physician getting that and submitting that to the lab. And of course, if it's a newer process, they might forget, right? So what CLIA is asking is that you have to have that written policy that sort of lists, how would you retain the specimen if you were going to, to get it? And then obviously, if it doesn't happen, then that's probably a result of, your procedure not going the right way, and perhaps a physician couldn't get that specimen. So possibly some documentation there as needed, but definitely need a written policy for that as well. Okay, so these are some changes to personnel requirements. Nothing truly earth-shattering, but just stuff that you should be aware of. I'm going to first go over those that have a doctoral degree, and this is in relation to CLIA. So we're not necessarily talking about certification, but we're talking about the ability to do these jobs in the lab per CLIA. So the DCLS degree, that's your Doctorate of Clinical Lab Science, is now considered an acceptable doctoral degree. So that's great news for anyone thinking of this degree or anyone that's gotten it. That's now going to be acceptable under the doctoral degree header. They did decide to remove DVM. So any veterinarians out there that might be functioning in a CLIA lab with a doctoral degree, it was decided that that degree is not relevant to testing on specimens that are derived from the human body. So that's removed. There is a grandfather clause for those folks. So if they're already in the job, they can stay in the job. If they leave the job for a number of years, they probably won't be able to get back in. So just as a side note, CLIA does not consider MD or DO to be the same as a non-medical doctoral degree. So when I say doctoral degree, I am not talking about a medical doctor or a doctor of osteopathic medicine. So the doctoral degree is just used to describe any type of post-grad level education, non-medical specific. Post-grad work does need to include at least 3 years of graduate level study in order to qualify under the doctoral degree. It needs to include research related to clinical lab testing or advanced study in clinical lab science or medical terminology. Honorary degrees will not count, which makes sense. Okay, moving on to training and experience. So this is just a blanketed training and experience topic to let you know that lab training or experience, they're sort of further defining that. Like, what does that mean? So when you hire someone new into your lab and you're determining what their experience is, this is what CLIA is saying, they're defining this as. So training or experience must be obtained in a CLIA lab. So labs that do not meet this criteria would be a research lab that only reports aggregate results or a forensic lab. Those are a couple of examples. It was decided that research experience is not equivalent to clinical experience unless you're reporting patient-specific results. So that patient piece is the really crucial piece of the experience. So keep that in mind when you're assessing and, putting your team into different buckets as far as, are they a technical specialist? Are they a training personnel? Those kinds of things. Lab testing of non-human specimens is not acceptable experience, and forensic testing is not considered to be acceptable either. Okay, moving on, I'm going to go over a couple points for directing or supervising with regards to experience. So again, this is more definitions that are being clarified. So if you are stating you have experience directing or supervising, that means that that experience must be obtained in a CLIA lab. So similar to that last slide that we went over. Teaching experience in an MLS or a CLS program is considered acceptable. So, for those of you that may be teachers, that's another route to go in order to qualify for a director or supervisor. With regards to the PPM lab director, there's just a couple points that they clarified with regards to who can and should do what. It's a little different from your typical CLIA laboratory. So the lab director will evaluate the competency of all testing personnel. So that's definitely different from what we're used to in larger labs. But in this type of setting, the lab director is expected to evaluate that competency, especially since most of the folks performing the PPM, if not all of them, are mid to high level practitioners. So they will be evaluating. They have to make sure the staff maintains the competency and results tests promptly, accurately, and proficiently. So this would include the 5 elements, not all 6. This applies also to mid-level practitioners, as I mentioned. And if you have a COC or a COA, the technical consultant can conduct a competency assessment. This is specific to your PPM lab director. Okay, so moving off of PPM, going on to regular laboratory director responsibilities. The lab director must be on site once every 6 months. So this might be a big one for folks that aren't already doing this. I've talked to a few people, a lot of them are. They may not be documenting it, so that's kind of what we're talking about. Not only do they have to be on site once every 6 months, they have to have at least a 4-month interval in between to make sure that it's sort of spaced out throughout the year. So for those of you that might have, remote directors that come in to visit and are also listed on your CLIA roster as, having director responsibilities, they need to be following this cadence. Now, if they come in once every 2 months and it's way more than, twice a year, then you're good to go, unless you're not documenting it. So you must provide documentation of these visits, and that can look a couple of different ways, or even more if you think of new ways to document. But you want to include evidence of performing the activities that are part of the lab director responsibilities. So this could look like a log, a checklist, a sign-in, a sign-out log, meeting minutes, or a summary, notes of observations, and travel vouchers. That is the verbiage coming from CLIA. I think if it were me, I'd probably have a checklist of all the, signed off on quality control, et cetera, and then they can sign. But as you can see, there's many ways you can do this. The lab director is still required to be accessible, and that's not new, to the laboratory for telephone and electronic consultation as needed. And this requirement pertains to only one location site visit per CLIA certificate. So if you have a lab director with the max of 5 certificates under them, they need to do this for every certificate. So you're looking at 10 visits a year to 5 different labs. The lab director is also expected to determine the type or process of documentation needed as evidence of the performing visits. So you can just leave it all up to them, right? They'll do it, they'll record it. Yeah, okay. You'll probably need to help them and help them track it and make sure it's done. But generally that responsibility falls to them. Okay, let's talk about technical consultant qualifications. So with regards to technical consultant, CLIA is removing doctoral master's or bachelor's degree in physical science as a means to qualify. So they're removing that, when you look at the qualifications, it'll say chemistry, biology, or a physical science. And most of us go, what is a physical science? What does that mean? Well, that's being removed. So if you're like me, you're clapping your hands in the background because that one was always an odd one to have in there anyway. They are going to be adding verbiage that An earned doctoral, master's, or bachelor's degree in clinical lab science is a means to qualify. So just kind of swapping those out, getting rid of that physical science. And they're also going to allow for individuals with an associate's degree in medical terminology or clinical lab science and at least 4 years of lab training, again, in a CLIA lab, in non-wave testing and the designated specialty or subspecialty areas of service for which the technical consultant is responsible for qualifying. So now if you have an associate's degree in medical technology and for your 4 years in your CLIA lab, you can now qualify as a technical consultant, as long as the testing was non-waived and it's in that designated specialty that you're going to be technically consulting for. So that's a great win for our folks with associate's degrees. They're also going to allow individuals who have earned a bachelor's degree in respiratory therapy or cardiovascular technology from an accredited institution that have at least 2 years of lab training or experience, or both, in blood gas analysis to qualify as a technical consultant for blood gas testing only. So think about your point of care departments. They will, that team, depending on how you organize your point of care department, the respiratory therapy team will be able to have a technical consultant that now can sort of help with competencies and be responsible for that because it's only for blood gas. So I think this is a win for the point of care departments, assuming they're well trained and they can, get their stuff done. You probably still have to, watch out for them, but it's just another helper within that department that can kind of wrangle everyone together and get them competencied. Last but not least, 18 months, this kind of pertains to the respiratory therapy, 18 months of clinical rotations that they acquired during their respiratory therapy or pulmonary technology school may count towards that requirement for 2 years of lab training and experience. So they use that word may. So, take that as you will, but you probably want to make sure that they actually got some lab training and experience while they were in their clinicals. Okay, testing personnel. So again, physical science is no longer in there. So, those kinesiology majors, you're not able to hire them. Keep that in mind. What was added is that an earned doctoral, master's, or bachelor's degree in nursing as a means to qualify. I know this is a hot button topic with a lot of people, and so I have a little more info on this one for you. So basically, if you have a bachelor's or an associate's in nursing, you can do moderate complex testing. So CLIA is saying that RNs cannot perform high complexity testing. I'm honestly not sure why they would want to, and it's probably in the minority, but they cannot. If they want to work in a lab, it would have to be moderate complex, which can also apply to some point of care testing. So not all a bad thing. Individuals with nursing degrees will no longer qualify as lab directors. So this is an important point to note. And just as I mentioned with the veterinary degrees, those that are already qualified and employed in a lab director position, let's say you've got someone with a nursing degree that you hired a few years ago, they will continue to qualify under the new provision, but they do need to remain continuously employed in their position after the effective date. So again, it's kind of like that. If you left it for a while and wanted to come back, you're not going to be able to. So just as an FYI at the bottom here, I have some additional info from CLIA. They did receive more than 19,000 letters, which oppose the proposal, which would allow RNs to perform high complexity testing. So anytime you send in letters, those are all noted and they are all responded to. So this is the exact final ruling on RNs performing high complex testing. High complex lab testing requires a higher level of knowledge, training, and experience, troubleshooting, and equipment maintenance skills and interpretation and judgment than moderate complexity testing. So that is why RNs are not eligible for high complex. Okay, technical and general supervisors. This is the last slide I have for you. So basically, they're going to allow individuals with a doctoral, master's, and bachelor's with appropriate training and experience. So again, going back to that CLIA lab training to qualify as a technical supervisor for immunohematology. So this is immunohematology specific, which was not specified prior to this update. Again, physical science degree removed from the supervisor qualifications, and the lab director or technical supervisor do have the ability to delegate the semi-annual and the annual competency for mod and high. So if you currently are in a lab with a technical supervisor that's delegating, they can do that. They can delegate to a technical consultant. So again, just more help for everyone to get those tasks done. Okay.
Right.
Yeah,
Thank you,
thanks
Elena.
everyone. Thank you.
Yep.
Oh, I'm gonna drop a couple links in the chat. I do have, if you want to stay up to date on some of these CLIA provisions, you can subscribe to my mailing list. And I also have a more in-depth summary of the info I went over if you want to look at more verbiage and page numbers. So I'll drop that in the chat. Thank you so much.
Yes, thank you, Elena. We appreciate your presentation. That was very helpful. I have a few questions here for you. How is CLIA lab defined? CLIA accredited? Question mark.
Can you say that again, April?
Can you hear me okay?
Yeah, sorry.
Okay. No, you're fine. They want to know how a CLIA lab is defined, and then they put CLIA accredited question mark.
Oh, sorry. Yes, that's exactly right. So a CLIA lab must have a CLIA license. So CLIA is saying, hey, if you want to have that experience, you have to work in a lab that we've accredited and we know is operating to a certain standard.
That would be a certificate of compliance. So there's a certificate of accreditation and certificate of compliance. The CLIA lab is a certificate of compliance.
Thanks for clarifying.
Okay, so this next question says, regarding 3 years training for non-MD/DO doctoral personnel, do folks with PhD, ergo biochemistry, with fellowship training, ergo 2 years in accredited clinical chemistry fellowship program meet qualifications? That says ACC accredited.
Okay, so we're wondering if a PhD, so you really need to look at that CLIA grid, which I can also drop in the chat box while we're during the meeting. I can get it for you. The important part is, yes, of course, with a PhD and a fellowship, the fellowship is going to be your, experience, years of experience. You should qualify, but you really want to look at those specific possible course requirements or whatever CLIA is looking for. So I'll get that grid loaded up for you.
Okay, thank you. The next question is, on-site for non-waived labs with waived labs being delegated? Question mark.
On-site, say that again?
It says on-site for non-waived labs with waived labs being delegated.
On-site for non-waived with waived being done. I'm not exactly sure what that means. I don't think that's a full sentence. Okay. If someone could clarify, that would be helpful. Yeah.
Yeah, if you could clarify that, that would be fantastic. And then this next one says, can the visit be delegated to another lab personnel? I think that might be in regards to the lab director.
So no, that cannot be that lab director must visit twice a year, 4 months in between. That portion cannot be delegated.
Okay, next one is a bachelor's degree in cardiovascular technology referring to perfusionist or other.
Yes, I believe that's perfusionist and like your respiratory therapy degrees. Exactly.
Okay. This person says, is a bachelor's degree in nursing not considered a biological science? And then they went on to further explain, my question relates to technical consultant qualifications. Will nurses who perform moderate complexity point of care for 2 years no longer qualify for a technical consultant?
Will nursing who do moderate complex, can you read the last part of that?
Yes. Will a nurse who performs moderate complexity point of care testing for 2 years no longer qualify as a technical consultant?
So the RN can do moderate complex testing. No, the technical consultant for RNs, I don't believe has changed. So that should stay the same. Again, I'll drop that CLIA personnel grid. You could take a look.
Thank you, Elena. And then this last one says, how would you justify respiratory therapy with 2 years of lab experience, initial training and competency by lab personnel? Will that satisfy it?
So they need to have 2 years. So if you have someone new coming in, look at their clinical rotations. I'm not sure from my end what a respiratory therapy program clinical rotation looks like. So definitely start assessing from there. If they've already been, say, in the hospital or in the setting for 2 years and you've already kind of been working with them and now you're able to transition these duties to them, then you should be fine. Or let's say they're newer to you, but they've been somewhere else. So look at, past positions. What did their clinical rotations look like and what have they done in your current organization in order to justify that?
Okay. This one is also asking about the RN as the lab director, and they were asking about the point of care, but Elena had also shared that she's going to drop that grid in there. So please review that. Sorry, a whole bunch more questions just came in. So
No worries. Yep.
there's a request, Elena, for you to share your slides for today's presentation. I know for myself, I was going to put my slides in a PDF form and also email them out. Will you be doing
Yep.
that for us as well? Okay.
Yep, definitely. You will get the slides.
Okay. I am working on this. Sorry. As a TS technical supervisor for immunohematology, can delegation be to someone with an associate's degree?
So you are a technical supervisor in immunohematology. Yes, exactly. That is what they just changed. So now kind of opens up your possibilities to look at the team members that you have that are MLTs, for sure.
And let's go back down to another one. So now, other than a medical director, qualifying personnel can be the technical supervisor. Right now, the TJC is telling, the Joint Commission is telling if you are not an MD, you are only a general supervisor. Is that what they're saying? Or is that just outside of the realm of this presentation?
Yeah, I would have to see the TJC regulation. I can't imagine though that they'd go against CLIA. But they could. So, if they're accrediting you and that's what they're saying, I would go with that. But maybe have a copy of that regulation for them to look at or send it over to them and ask them to assess it.
Um, then it said, what is the PPM lab director? I guess they have questions about that.
Is the question, what is a PPM lab director?
I think so.
Okay, so P no worries. PPM is your provider performed microscopy. So that's if you have providers doing any type of microscopy like wet prep, ferning, KOH, all those fun things. That director needs to be an MD, sorry.
Okay. I'm just going to do this one last one. We have still several more in here. If we did not get to your questions, you can also email Elena, myself, or Maria to answer your questions.
Yeah, definitely.
Our emails are available, will be available in the chat and everywhere else. I'm going to ask this last question so we can move on. Thank you all for your participation. I appreciate it. This one asks, when do these changes take effect?
So my changes, the ones that I went over, are going to be January 2025. So you have a little bit of time to look into those and get them going.
All righty. And we're going to hand it back over to Jay so that he can introduce our next presenter.
All right. I'm going to paste their bio in the chat. Basically, Maria is a top board exam performer in medical technology and has advanced from apprenticeship to a lab manager role. She's worked in microbiology, pursued graduate studies, and founded Clinical Laboratory Scientist Consulting. She's active in professional organizations for continuous growth. Maria, it's all yours.
Thank you, Jay. Let me share my slides. Do you guys see my slides?
Yes.
Okay, thank you. So, hello everyone. I'm Maria Suabiera of Clinical Laboratory Scientist Consulting, and I'm so excited and happy to be here. Thank you for carving out a space in your schedule to be with us, and I would give a special shout out to those who belong to different time zones for forgoing your sleep and being with us here. So before I proceed to my presentation, I would like to say a quote from one of the greatest teachers of all time. And the quote is, "The law is made for man and not man for the law," which is appropriate for our topic, CLIA changes or regulatory changes. So with that, let me proceed to my first slide. I will be talking about the revisions for labs under Certificate of Waiver and Provider Performed Microscopy procedures, including fee changes. I would also briefly talk about redesignations and renumbering of provision codes. And last but not the least, I will present the effective dates for all CLIA changes in the final rule under Part 493. Let me go to the next slide. I would like to mention the objectives of my presentation briefly. By the end of our presentation, you will know the benefits of the imposition of alternative sanctions on laboratories under a certificate of waiver. You would also know the personnel changes for laboratories under certificate for provider performed microscopy procedures. So from this point on, I will be referring to those labs as COW and PPM respectively. You will also know the fee changes for issuance of certificates and the additional fees for COW and PPM labs. Number 4, you will understand the rationale behind renumbering and redesignation of provision codes. And number 5, know which provisions that are effective January 27, 2024, and those which will be effective December 28, 2024, which is the end of this year. So proceeding to my next slide, before I will proceed in discussing the changes to the COW labs, let me make a background information on the present state of COWs. Because the CLIA changes for these labs are effective end of this year, which is December 28, 2024. So they are technically still under the old provisions. So at present, COW labs are exclusively performing wave tests, which I think will not change. They will still be performing wave tests. And what are these wave tests? We all know that these are simple tests that have very little risk or insignificant risk for erroneous results. And at present, they are exempted from alternative sanctions, meaning they are not subjected to the biennial surveys, the surveys that occur every 2 years, where labs are required to meet certain conditional requirements. And if you are planning to open a COW lab, hold on your horses because they are not exactly immune to inspections. COW labs are still inspected if and when there is a complaint filed against the laboratory. So we have now what we call a complaint survey. And based on the results of the survey, CMS can actually impose principal sanctions. And what are these principal sanctions? They are revocation, they are suspension, or limitation of CLIA certificate, which are a bit harsh, which are a bit stiff because they actually disrupt laboratory operations and which can result to negative economic impact for the laboratory. So what is CMS doing to remedy the situation? They made amendments to CFR 493.1804, Section C, Paragraph 1, which will now allow CMS to impose alternative sanctions. And the purpose for that is to steer COW labs into better compliance without additional significant economic impact. So what are these alternative sanctions? We have civil money penalties. They also provide full direction on a plan of correction or direction on portions of a plan of correction. And they can also do on-site state monitoring. So these sanctions are applied to labs where a complaint is proved to be substantiated, which means there's really evidence that the lab has a violation or a deficiency. And I would also like to point out that alternative sanctions are imposed in addition to or in lieu of principal sanctions. I would like to emphasize that because I've attended a webinar once and they only stated that alternative sanctions are in lieu of principal sanctions. Alternative sanctions are actually meant to expand disciplinary tools for CMS so that labs can be steered towards better compliance without additional significant economic impact. So as you notice, I highlighted amendments, the number of the provision, and also the phrase in addition to or in lieu of, because they are hyperlinked. If you put your cursor on either of them, you do a right click and select open link, it's going to take you to the Federal Register document. So as a background, what is a Federal Register document? It is actually a daily journal of the federal government of the United States, and it publishes government agency rules. It also publishes proposed rules and public notices. And since CMS is a regulatory agency that implements the CLIA program, changes to the CLIA program are logically published in the Federal Register. And the purpose of that is so that the public can be notified of the proposed rules so they can have the chance to make their own comments. So what happens now when COW labs are subjected to alternative sanctions? Well, they will now be aligning with labs holding other certificates. So those other labs are those that have certificate of registration, certificate of compliance, certificate of accreditation, or certificate of provider performed microscopy. So by December 28th of 2024, when this rule takes into effect, all labs under CLIA will be subject to alternative sanctions. So let's go to the next slide. So what are the benefits to alternative sanctions? CMS, by subjecting COW labs to these sanctions, they are expanding their disciplinary tools so that they can provide flexibility, which means they can now impose less disruptive options when addressing compliance issues. They can also reduce the burden on the labs, especially regarding the administrative and operational processes of the laboratory by providing appropriate sanctions to compliance issues that are less severe. For example, PT referral. And we all know what PT referral is. It's when you send out your proficiency test to another laboratory so you will know the correct answers, and then you submit that to your proficiency testing agency. And last but not the least, it also enhances oversight, because now there's these intermediate steps of correction that would result to better compliance and quality assurance. So what is my tip for this? I know there's more rules now, but it's for the benefit of the laboratories and especially for the patients. That's what we're all here for. So my tip would be, since there's still 5 months for the rule to take into effect, you can have a meeting with your staff and discuss possible risks that might bring about a complaint survey. For example, let's take PT referral. You can formulate preventive solutions that will minimize or eliminate their occurrence. For example, if the lab doesn't have a policy yet, you can actually have a policy regarding PT referral and also spell out consequences if and when somebody decides to violate that rule. Because after all, an ounce of prevention is still worth a pound of cure. So let me go to the next slide. After all the changes for COW labs, we will now be discussing changes to labs under certificate for provider performed microscopy. So there are a couple of major amendments to, there are two provisions where amendments have been made. And the first one is to CFR 493.2 definitions. The mid-level practitioner definitions were now expanded to include registered nurse anesthetists and nurse specialists, and they are now allowed to perform PPM tests. And the purpose of this is so that PPM testing will be readily available to patients. And the second one is amendments to 493.1359 regarding laboratory director responsibilities. Before, there was no explicit assignment as to who will perform competency testing to personnel in PPM labs. And there was also comments that why don't you allow technical consultants to do that? But unfortunately for PPM labs, there is no personnel category for technical consultants. So that's why they put this amendment, and which serves to clear that issue, that responsibility is now given to the lab director. And competency assessment intervals will now, that is the competency assessment intervals of testing personnel, which is every 6 months when the personnel has started testing, and 1 year thereafter will now include mid-level practitioners. So let me go. So as I mentioned before, I highlighted both provisions because if you do a right click and select open link, it would take you directly to the Federal Register document, right to the paragraph of this provision. So let me go to the next slide. So these are the fee changes for COW and PPM labs. And we all know that before a laboratory can start operating, you have to apply for a certificate and you have to pay for that certificate. So currently, COW labs are paying $180 and PPM labs $240. But when the changes of fees will occur, which will now include the 18% across the board increase plus the biennial increase of 4.96%, which is actually a calculation for inflation. COW Labs will now be paying $248 for certificates, and PPM Labs will now pay $297. And if you do a little math, the COW Labs have actually a little bit more of an increase compared to PPM Labs, and I will explain that on the next slide. COW Labs, since they perform wave testing, and we all know what federal agency does the determining if a test meets wave status, and that is the FDA. So COW Labs will have to pay FDA $25 to do that function. So the 248 will be the $25 for the FDA, plus the across the board 18% by 18% increase and the biennial increase of 4.96%. So what are the reasons for other authorized fees? So aside from the certificate fees, there are other authorized fees. So number one, these fees will be associated with substantiated complaint surveys. If you had a complaint survey before and you weren't paying for the inspectors to come to the lab to see if you really committed a violation, now you have to pay CMS for that. And we also have replacement certificate fees. And this is for labs that have lost or damaged their original certificate and now would like to request a replacement, because CMS has noticed that the laboratories are not mindful of the way they handle their certificates. So a lot of certificates were issued. So to let the labs pay more attention to their certificates, they are charging a fee. And there's also a fee for revised certificate. And it happens when an information in the certificate, such as a change of lab director, needs to be reflected on the certificate. And now the lab will ask for a new certificate to reflect those changes. So what are the projections for the other authorized fees? So we will focus on the last two rows of the table. And I purposely put this table there, even if there are other information, because we have such a thing as transcription error. The more we transfer information to another place, the more likely are we to commit transcription errors. So under the column Substantiated Complaints Survey, the Certificate of Waiver Labs will pay around $2,059 if and when a substantiated complaint is established. But if there is no evidence for a deficiency, the laboratory will not be charged. So for Certificate of Provider or PPM, they will pay almost twice that. And the projection is $3,858. For replacement certificates, both labs will pay the same, $75. And for revised certificate, COW Labs will pay $95, but while PPM Labs will pay a little bit more, which is $150. So now, I will briefly discuss about the redesignations and renumbering of provisions. The purpose of these processes is to give space for the introduction of new provisions or to explain or clarify existing provisions that are related to each other, so that the themes among these provisions is preserved. So for example, provision 493.646 is now redesignated as 493.655, and this is regarding payment of fees, because the provisions before this are all the fees that will be charged to the laboratories. So it's only appropriate that this provision will be about how to pay those fees. And there's also a new provision, which is 493.680, which is the methodology that CMS used to calculate for biennial fee increases. And another example is 493.1278. This is about histocompatibility. And CMS, if they see that there's a redundancy in the paragraphs under the provision, they take out that paragraph and move over the succeeding paragraphs. So for example, for paragraph 3 was taken out and paragraph 4 was revised and redesignated as paragraph 3. So now there's a vacancy. So they bumped up paragraph 5 and redesignated it as paragraph 4. So the whole point of this is to give space for new provisions while maintaining the theme among the provisions and also reducing the redundancy among the provisions. So let me go to the next slide. So these are the provisions that would take effect January 27 of 2024, which was the beginning of this year. They actually took effect already, and these are all about the fees. Fees will be first. So all of these are hyperlinked. So if you do a right click on any of the topics that you're interested in, and you select open link, it will take you to the paragraph on the Federal Register. So let me see what else. Okay, so let me go to the next slide. The provisions effective December 28, 2024. There's actually 2 slides for this. This is slide 13 and 14. And that is because these provisions are the rest. The fees are already effective, and the rest of the provisions will be effective end of this year. So if you are interested in any one, this is also connected to a hyperlink, and you can be taken to the Federal Register when you select open link. So to close off, in the face of these looming changes, let's look at the bright side. These changes are in keeping with the goal of preserving patient safety by providing accurate results. It's for the preservation of the health of you and me, our loved ones, our communities. So it is all good. So how ready are you for the CLIA changes? Thank you.
Thank you, Maria. We appreciate your presentation, and we'd like to take a moment to ask any questions. I have a couple questions up. They don't really pertain to all that you were covering. One person asked if there was going to be any more webinars or other changes. You'll have to elaborate on that. There's a lot of information out there. I'm going to cover some more stuff in my presentation next. And so if there's anything that wasn't covered that you want to know more about, please email us. We have really enjoyed working together to put this information out for you. We've enjoyed our interactions with the CLIA surveyors that have guided us through this process. So I think we're definitely looking at doing more in the future. So if you have any questions or things that we aren't covering that you want to add, please do so. Email us about that. A person did ask about the technical consultants on moderate complexity labs. I have published that. I'll let anybody who wants to answer those go ahead and answer those for them. Does anyone have any questions about the CLIA certificate of waiver or the PPMs or changes in the new regulations as far as like the coding and stuff like that? Maria has the links. I also am going to share a link with you that will take you where you can also go and just take that right off of a PDF as well in the chat. So does anyone have any more questions for Maria? Okay, you can always email her as well. Maria, thank you so much for your time and your efforts and your presentation. I'm going to take over now and start my presentation here shortly. Get it open for you. Let me get to the correct window. Takes a moment. Thank you. Alrighty. Okay. Oh, did not mean to go there. I'm gonna go there. Okay. All right, Jay. You are up.
Okay. April holds dual bachelor's degrees in biochemistry and biotechnology, completed her MLS, and now does quality assurance directing for Lab Connections. She's a certified quality manager and active advocate in the American Society for Clinical Laboratory Science. How about it?
All right. Okay. I just want to note really quick for everyone over here in the chat, I did drop a link that will be available until the end of the year. If you cannot get into the OneDrive link, please email me and I will send you the information. That contains all of the documents that you will need for my presentation as well as the previous two presenters. Okay, so, my notes are not there. Whoops, excuse me. For some reason my notes didn't upload. I apologize for that. Okay, but that's okay because I have information here just in case they did not for some reason upload. First of all, I want everybody to just take a deep breath. We've had a lot of information today. We're getting ready to go over some economics. We're going to go over some history, and then we're going to cover how these fees are actually going to directly impact you. So let's take a deep breath in and out. Okay, so here goes the economic lesson. There has been an 18% across the board general fee increase. You're wondering why this fee increase was implemented. It is because they did this in order to fund annual program obligations and build an operating margin for CLIA. There's going to be a two-part periodic increase system that will be established to provide a clear and understandable method for calculating fee increase, and they will be published in the future. Any future fee increases will be published by CMS in the Federal Register, and this will ensure transparency. What they will be doing is how they came about this particular fee, where it is the 4.95, or let's face it, we can round here because it's economics, up to 5%. The reason how they calculated this is they use the Consumer Price Index for all urban consumers, and they will continue to review those every 2 years to determine if they need to raise the percentage cost again for CLIA fees and certificates. The good news is those will be published if there is a fee attached, a new fee adjustment that occurs. However, if there is no fees, there will be no publications. So it's like going to your provider. No news is good news. So right now there's an 18% increase. So that will be reviewed every 2 years. If there is a new fee increase, the calculations and how they came to about those adjustments will be published. And if there's no publications, we're good. No fee increases. All right, now we're going to go on down to a little bit of history. Who knew scientists would do economics and history? But welcome to CLIA regulations. The CLIA Fee Authority has set in place regulations that authorize the collection of additional fees historically. This was put in place in February of 1992 in the federal rule. However, these fees were not implemented due to confusion. The information was not very clear. There are there were federal surveyors, contracted surveyors, and state surveyors, and the information was not very clear. So in 2022, they proposed a new rule to determine how to make the fees more clear and accessible. So they went through the process of approving that, and that is currently implemented. So it is, at this point, your CLIA surveyors can officially charge you these new fees. We're going to go over what all they are and what they mean and how they apply to you. There are accredited, there are the accreditations and the states that are exempt. So if you fall under an accredited lab or an exempt lab, please reach out to your regulation advisors to determine how this is going to directly affect you. Because you're accredited and exempt, that does not make you exempt from new regulations. You just need to reach out to them to determine how to communicate with them on that. In the CLIA webinar presentation document that I posted in the chat, you will be able to access your regulation. You should already know who they are, but if you do not know who those people are, please go to that document and look that up. All right, we have covered economics, we have covered history, and now on to the question, what is this going to cost me? Because let's face it, that's what we all want to know. We're here to know, what is all of this going to cost me? This is the new CLIA certificate fee schedule. This is also available in that document that I shared in the chat. Please note your lab type, your number of specialties and subspecialties, your test volume, if you have a CLIA certificate of compliance, or if you have a CLIA certificate of accreditation. That information is all here. Maria went over the fee schedules for the certificate of waiver and the provider performed microscopy, but this has the whole information available to you. Please note that there is some fine print at the bottom. I'm not going to skip over that. That is what we're going to cover in the next slides. So these are your estimated costs, or these are your costs for your survey fees. Also remember that those that are accredited, they have a CLIA certificate of accreditation, there are 5% that will be inspected by CLIA, so those fees will apply to you, but also the revision of the certificates for you is a little bit cheaper due to the fact that you fall in that 5%. So they were trying to make it more even across the board for everybody. All right. So now we're here on to, I don't know, well, that's okay. Sometimes whenever these things upload, they don't upload correctly. So I have a little bit of an error there on my slide. I apologize for that. Let's discuss how this is going to affect you. These are going to impact you for issuing and revising of certificates when there is a change to the laboratory director or other certificate details. Replacement of certificate fees for laboratories that lose or damage their original certificate and request a new one. That's still $75. That was not changed. Fees for proficiency test desk review related to unsuccessful PT performances. That's the big one, and we'll get further into that here in a moment. Fees associated with the investigation of a substantiated complaint, as my previous colleague went over for certificate of waiver and for certificate of, or for the PPM, I will be going over that for the certificate of compliance. Then there's also additional specialty fees that will be required for outside of cycle, which would be for the certificate of compliance. Okay, let's start with the additional fees. So I missed that part, sorry about that. Okay, additional fees. So if you need a fee for a revised certificate, then, if you need a revised certificate, there will be a fee that you will be charged, and that was implemented on January 27th of 2024. For any revisions, will be a change in laboratory name, change in the laboratory location, change to the laboratory director, or changes in services offered included in specialties and subspecialties. If you are uncertain about what your subspecialty is, specialties and subspecialties are, you can also find that. I put it in the CMS document. It's on page 4 of the CMS document of 116. That is also available to you if you need to review that to see if you qualify for needing to change your certificate. Also, once again, we can celebrate no replacement for damages, but the reason they put these in place is because they had a lot of requests for new certificates, and they were getting bogged down with these requests, so they had to raise the fees on these to cover the cost of sending out new certificates. Okay, on to the, and then also, here's also, this is encouraged for better management of your certificates, ensure accurate information is provided. Please slow down when you're filling these out. If you need help with filling them out, please reach out to your surveyors, and they will help you fill them out. They are always available, but it's really important that you get these filled out the first time. It saves your lab money, it saves your inspector's time, and it just reduces the cost of having to make a whole lot of duplicate documents. All right, now we're on to the fun stuff. I know that a lot of people have probably already heard about the new target values for proficiency testing. However, if you have not, please review this slide deck that is posted also in the CLIA webinar presentation link that I gave you. It was put together by Sarah Bennett, the Technical Director at the Division of Clinical Laboratory Improvements and Quality. It covers all the new proficiency testing in the final rule that went into effect this last week on July 11th, 2024. You have 6 months. It will be implemented on January 1st, 2025. This is really good information, because the target values have been reduced substantially for your proficiency testing. If you need any further information, you can visit the WestGuard's website at www.westguards.com. For WestGuard QC, it is free. They have an on-demand webinar also covering additional information for target values. So without further ado, let's talk about why it's so important that we know what the new target values are for proficiency testing. It is because there's now going to be what's called a proficiency test desk review. The proficiency test desk review is officially in effect and implemented. It went into effect on January of this year. So what does this mean? A PDR is triggered when a laboratory receives an unsuccessful score. That's meaning a failure to attain a minimum satisfactory score for an analyte test, subspecialty, or specialty for 2 of the 3 consecutive testing events. So let's get into the meat of what that means. The definition of an unsuccessful score. So an unsuccessful score means that you have had 2 failed or 2 unacceptable or unsuccessful events, or too many unsatisfactory PT events. So an example would be for potassium, let's just take potassium because that's a really easy analyte to think about. If you have on your first event an unsatisfactory event, which is a less than 80% score for your potassium on your first proficiency test event that year, then that's one. That's considered unsatisfactory. Let's say event 2, you pass. You got an 80% or above, and you've officially passed this score. That means that you're not in the clear. If you fail, if you have an unsuccessful on that, or if you have an unsatisfactory on that event, you have experienced an unsuccessful. However, if you passed and you were successful, and you go on to event 3, and you have another unsatisfactory event, that is an unsuccessful. So they don't have to be 2 in a row. You could have one in between, and this is continuously rolling. So make sure that you're being aware that you have this when you have an unsuccessful event, so that you can be aware that you could be charged a fee for a desk review for your plan of correction. So what are your next steps when this happens? Of course, the laboratory will do their investigation of their PT event. They're going to provide a plan of correction. There will be a follow-up assessment to ensure compliance and improvements by your CLIA director. So you'll submit that plan of correction to them. They will advise you on if they accept it, or if there needs to be any additional things added to that. This will be billed at an hourly rate of $111 an hour for this desk review. Anytime you have to go back and forth with them, they're going to bill you. They're going to bill you for all of the work that they do for your reviews of your plan of correction now. That is no longer a freebie. A failure to pay your PTDR will result in a limitation, suspension, or revocation of your CLIA certificate. So please be aware that this could really impact your lab. It's very important that you understand what this means for you and how this affects you. All right, are you all still with me? I know we just got through the hardest part of that. Let's go on to the next one. There's additional fees that will be, that are now in effect, that were implemented once again at the beginning of this year. These are fees associated with the investigation of a substantiated complaint. That is also going to be billed at $111 an hour plus additional travel expenses. So if a surveyor shows up at your lab due to someone submitting a complaint against your lab, they're going to do an investigation. If that investigation is substantiated, you will be charged $111 an hour plus the travel expenses and the time that the CLIA surveyor is on site. If they show up and they do not find any if they do not find any deficiencies and the complaint is unsubstantiated, there is no fees attached to that. Also, a complaint does not trigger a outside of cycle survey. So if you have a complaint, they're just going to show up and they're going to investigate the complaint. The additional fees for the outside of cycle survey is for a B-visit inspection. A B-visit inspection would be that if during your initial inspection there was a condition level non-compliance and the surveyor needs to do a B inspection and return back to the lab, that also will be billed for an additional fee of $111 an hour plus additional travel expenses. So please keep that in mind. If you incur any of these expenses and you fail to pay them, All of these can result in a revocation, suspension, or limitation of your CLIA certificate. Not to be cliche, but just remember that teamwork makes the dream work. Your CLIA state surveyors are here to help you succeed, so please reach out to them. Please ask them questions. You can ask us questions. We are always happy to help you navigate this new information. They're here to help you improve patient care and to implement new actions that can prevent patient harm. So that concludes my presentation. Please reach out to your state surveyor for information. As always, this was lab tested and CLIA approved. Thank you guys so much. Does anyone have any questions? Let me go look and see if there are questions. Okay. Let's see. Okay, is the PT desk review for all analytes or only those that are regulated? The PT desk review will be for those that are regulated. So as far as I know, I can clarify that, but from my understanding and the interpretation of the data, it would be just for those that are currently being regulated. But also note that on the new target values and new regulations, there are new tests and analytes that are being added to the regulations. So please be aware of that as well. Elena, here is a question for you. It says, the lab director technical supervisor will be able to delegate both semi-annual and the annual competency assessment for moderate and high complexity. Please explain how this will affect blood bank competency assessment. Will AABB adopt this change also? And how about competency assessment for testing personnel performing manual differentials?
So let me address the first bit of that. If we're talking about immunohematology, that often has its own, as you know, rules. So what I shared, the change that I shared is for the general lab director. So that means that nothing has changed for blood bank. So if you couldn't do it before, you still won't be able to do it. April, what was the last piece of that question?
Let me go see.
Sorry.
No.
That was a two-parter.
It was a good question, yes. Please explain how this will affect blood bank competency assessment. Will AABB also adopt these changes?
So like I said, if it hasn't changed for immunohematology specifically, I'm sure AABB will probably not adopt that change, but you should check with them as well just to be sure. Was there another part to that, or?
There was, yes. How
Okay.
about competency assessment for testing personnel performing manual differential?
Competency assessment for testing personnel performing manual differentials. So that is included in the regular testing personnel, high complexity testing. And so that hasn't changed. That can be delegated, as I mentioned earlier this morning.
So have another question here also about the analytes, regulated analytes. Yes, there are a document that has all of those analytes listed that are now going to be added. I don't have that readily available. I probably should have. It is, I will send that out to everyone. It has been continually changing. The target values have been changing and the regulations. They put new stuff in all the time. So please keep up to date on those changes. I will try to share with you the new information. At the end of this, I'll go ahead and put that in the chat as well, or I'll add that to that document that you guys all have access to. So please make sure that you Go in there and get all of the resources that we have provided for you, and I will go in and add that information as well. I didn't want to focus too much on the proficiency testing, analyte changes, the target values, and the new analytes, because there's a lot of really good information already out there. And we had to make this, everyone has to go have lunch at some point. So we can always reach out to some other people and see if we want to create another webinar. But there is a lot of information already out there, like I said. The West Guards have information on it. CMS, I gave you that. I gave you a link to the slide deck for that information as well. You can get that list from your surveyors. You can get that list from your accreditation body also as well. So it's out there. Everybody is aware of it. They should be sharing that new information with you because it's really important. Because if you can't hit your target values, you're going to get charged. And that's the really important thing. That's what brings all of this together. Because, we're all on a budget, and we all know that there's not a lot of available resources. So the last thing we want to do is be paying a bunch of fines and fees because we can't meet the new proficiency testing targets. Like I said, they're giving you a window of 6 months for that. It was in effect last week on July 11th. I just want to make sure everybody understands that. And it will be implemented at the end of the year, or at the beginning of next year, January of 2025. So that's when, you'll probably be receiving these, more of these desk reviews, charges for the PT desk reviews. Does anyone else have any more questions that they would like to ask any of us? Okay. If you have more questions, you are always welcome to email us. I'm going to put my email also in the chat. I know that Elena and Maria did the same. Sorry, talking and typing at the same time. So you can reach out to us. And then I want to do a quick recap. Thank you all for joining us. We appreciate your time and your participation in today's webinar. We hope that you found this engaging. To recap what we went over, regulatory updates. I keep tilting my head because when I did a test on these and uploaded all these slides, they were even and they worked out really well, and all of a sudden they shifted. So I have no idea what caused that. So I appreciate you all being patient with me as my slides looked a little off. So that's technology. It happens. I could do 1,000 tests, and sometimes something's always going to be just a little bit off. But anyways, a recap, we went over the Code of Federal Regulation amendments, histocompatibility testing and updates, CLIA fee schedule changes to the certificate of waiver, incorporate limit specific laboratory fees, changes to the provider perform microscopy, personnel roles, and responsibilities. Thank you guys all for joining us. Here is our information. Please stay connected. And thank you again for your participation. Oh, sorry about that. There was a correction. I should have probably, yep. Thank you, Aaron, in tech support for correcting my email. Everybody have a great day, and I hope this wasn't too exhausting. Bye-bye.
Oh, April, I made a mistake of leaving the chat, so I wasn't able to put my links on the chat. So can I share?
I included them already for you, Maria. They are in.
Oh, thank you.
So any of them that you sent to me, I have a document that I shared. They have access to it until the end of the year. So anything that anybody may have missed, as long as you go to that document, it is available for you. It has all of our stuff in it. Thank you all.
You can go ahead and stop the recording now.